Hello everyone, let's look at this fantastic story coming straight out of Ghana. My beloved country has just made an enormous leap forward in healthcare, and trust me, this is big. The Korle Bu Teaching Hospital, KBTH, has officially pulled off something incredible, Ghana's first ever kidney transplants done entirely by a local team. Yep, you heard that right. Not a single foreign specialist was involved in the actual operation. This isn't just a proud moment for Ghana, it's a game changer. It's a giant step in our journey toward being self-reliant in healthcare, especially with those complex medical procedures that, let's be honest, used to be reserved for fancy hospitals abroad. And here's the best part, this milestone doesn't just show how far we've come, it's paving the way for countless benefits in the future. Let's unpack why this matters so much and what it involves. 1. It's a leap in local healthcare capability. Wow! The successful kidney transplants at KBTH are more than just medical procedures, they're a groundbreaking moment in Ghana's healthcare story. These surgeries, performed on July the 4th and 5th, 2023, involved a team of Ghanaian specialist doctors, nurses, and anesthetists. The best part? Patients no longer have to endure long flights to places like India or South Africa for these life-saving treatments. Plus, they save themselves the jaw-dropping costs that come with going abroad. 2. Cost-effectiveness of local transplants. Let's talk numbers because, let's be honest, they matter.
Just educate me. Why is the kidney thing so traumatic? And I think in the past year, the kidney issue, whether it's the price of dialysis or renal equipment, keeps coming up. What's going on with that?
Okay, all right. So thank you. So, Korle Bu is the hospital that has the largest cohort of renal patients. And so at the point we had about 300 patients, chronic kidney failure patients who were on our, utilizing our service. And so in 2017, it was, the management then realized that many people could not afford the cost of dialysis. I actually know several people, when I was a medical student and when I became a medical officer who lost their lives because of kidney failure because they couldn't afford dialysis. At that time, the cost of dialysis was about $100 a session. Okay, and so that was what it was. And so in 2017, the hospital, tried to look for means of supporting our patients. And so we engaged with this philanthropist, first guy, Mr. Kutoche, who gladly came on board and decided to subsidize the cost of dialysis services in Korle Bu. So from 2017 to last year, 2023, about 230 patients were on this service free of charge. They didn't pay, so they were getting 2 sessions of dialysis every week free of charge. Now in 2020, when COVID hit, every institution had some challenges. And so of course his business had a challenge because the payments were not as forthcoming as before. And so Korle Bu, and this was when I was in office, so we had a choice. Either we stop the free service and let the patients pay, or we exercise faith, and prioritize the health of our patients and continue providing the service. So we decided to do the latter, which is to continue providing the service in the hope that, because like the president said, you can know how to revive the economy, but you don't know how to bring back lives. And we knew that if we stop the service, even if the free service resumes later on, many of these patients may not live to see that day. Okay. So we decided to prioritize, and that's why we decided to continue providing that service free of charge.
Each kidney transplant at KBTH costs $21,000, a steal compared to the $250,000 or more that patients typically pay abroad. That's like comparing a first-class ticket to a bus fare. This massive cost reduction means more people can now afford treatment without drowning in debt or selling off everything they own. It's a big win for patients and their families, bringing hope where there was once despair. 3. The role of the First Sky Group. Here's where it gets even better. The First Sky Group, a homegrown private company, stepped in to foot the bill for these surgeries. Can we give them a standing ovation? Their financial backing didn't just make these 2 transplants possible, it's part of a more significant commitment to fund dialysis treatments and future transplants. And they're not stopping there. The company plans to keep supporting KBTH to ensure more people benefit from these life-saving procedures. It's heartwarming to see corporate Ghana stepping up like this. 4. Strategic developments and future plans. But wait, there's more. KBTH and First Sky Group plan to build an ultra-modern kidney transplant center. Think state-of-the-art equipment, top-notch facilities, and a hub for training local doctors and specialists. This center will make Ghana a leader in kidney care across the region. And here's the kicker, it will eliminate the need for Ghanaians to travel abroad for treatment. That's a game changer, folks. 5. Impact on local medical talent. This initiative isn't just about patients, it's also about the doctors and specialists who make these miracles happen. By offering facilities to perform advanced procedures like this, KBTH gives Ghanaian medical professionals a reason to stay and thrive at home. No more brain drain, where the best and brightest leave for greener pastures abroad. Instead, they can hone their skills right here, helping to raise the standard of healthcare for everyone. 6. Legislative and ethical frameworks. Of course, with great advancements come great responsibilities. KBTH is working on ethical and legal frameworks for organ donation and transplants. It's a delicate balance, ensuring the rights of both donors and recipients are respected while keeping everything above board. These frameworks will set the gold standard for how transplants are conducted in Ghana, building trust and ensuring fairness in the system. Public health implications. Kidney disease is sneaky, it's often called a silent epidemic. And it's hitting young people in Ghana hard, thanks to lifestyle and environmental factors. But with local transplant capabilities, KBTH isn't just treating the problem, they're setting the stage for prevention. Imagine a future where fewer people develop kidney disease because of better public health strategies. It's a win-win, healthier people and lower healthcare costs in the long run. To end my submission, these kidney transplants at KBTH aren't just about 2 patients. They're about Ghana taking control of its healthcare future. This milestone proves we can achieve world-class outcomes with investment, innovation, and local talent. The ripple effects will be massive: better public health, economic savings, and a stronger healthcare system. Plus, it sends a clear message to other countries in the region: if Ghana can do it, so can they. So here's to KBTH, the First Sky Group, and everyone else who made this possible. You've given us hope, shown us what's possible, and set the bar high for what's next in healthcare. Let's keep the momentum going.
Thank you for tuning in to NewBlacksGhana. We'd love to hear from you, so drop a comment below and let us know your thoughts or any questions you have. We're here to help and connect with you. Stay tuned because we've got another exciting video coming your way soon. See you next time.